An estimated 13 to 20% of children living in the United States experience a mental disorder in a given year. According to a report by the CDC, the prevalence of these conditions is increasing, and they considered it an important public health issue because of its impact on children, families, and communities.
The challenges that mental health issues create for businesses and communities are wrapped around both the human cost as well as the financial cost, in terms of billions of dollars in time off is required in terms of for families and individuals to deal with their own impacts of mental health or their families. For the community, we're looking at time required for emergency rooms, first responders, judicial systems. Not dealing with mental health issues sooner cost us billions of dollars in all those areas.
An ill child takes a toll on the family. The siblings wonder what's happening. Sometimes they feel left out. The family just normally doesn't know what to do with a child who's got an illness, and the onus of the illness can be very detrimental to the entire family.
In 1984, Sue Gilbertson's son was diagnosed with mental illness. Facing an overwhelming lack of services and support, Sue discovered other families facing the same challenges. Together, they formed M.I.K.I.D to help support children and families struggling with mental health issues.
Peer support is so valuable because the people that are helping you have been through some of the things you're going through too. They've tried many different things, and they will share with you things that have helped them a lot and helped the whole family stay together and the kids to be able to understand one another.
Family and peer support can have a positive impact for both the child and their family.
The research time and time again around family support and peer support demonstrates that these practices increase engagement in our health care. Engagement in our health care increases better outcomes and reduces the cost overall.
Peer support has helped my child focus on directions for his future, and for me, it has alleviated many of my concerns for how he will manage his adult life.
Over the years, the organization has grown and expanded its family support and community education.
What M.I.K.I.D does is help families navigate a very confusing system when they find themselves with a child with a diagnosis of mental illness. It's a very confusing system and very difficult in terms of schools, doctors, other providers in the community. In addition to that, we provide the youth with support and skill building so that they become a better part of their family, a better part of their community, and the family becomes independent. Helping families become independent is what we do.
Prior to receiving peer support skills from M.I.K.I.D, I was very worried about my child's ability to navigate his adult life, but those fears have been alleviated. They just seeped away from me.
Due to the success of the program, the team hopes other organizations throughout the country can replicate their efforts to secure funding through Medicaid and other sources.
Not all states reimburse for peer and family support like Arizona does. Our Medicaid organization called Access, Arizona Healthcare Cost Containment System, early on applied for waivers that allow them to be able to reimburse these services. Any state can apply for that waiver and is almost always approved by CMS, Centers for Medicare and Medicaid Services, because they have seen the research and they understand the impacts and the positive impacts of the direct care services of peer and family support.
For over 30 years, M.I.K.I.D has been committed to supporting children and families dealing with mental health issues. Through education, advocacy, family support, and community engagement, M.I.K.I.D is changing lives for the better.
Supporting programs like M.I.K.I.D is really important because it provides young people like myself who grew up in the system the opportunity to have family support to get connected to achieve their dreams of adulthood.
What we know is that all of us' health is improved when we engage with our providers or our medical providers or our behavioral health providers. What M.I.K.I.D does and what the peer and family support services do is help families engage in the system. So it takes all of us. It takes the doctors, it takes the counselors, it takes the therapists, it takes our peer support, it takes working with the kids as well as working with the families to make this all come together. So we're just a part of that bigger system, but the outcomes are better when peer and family support is a part of that system.
I support M.I.K.I.D as a family-run organization. People who have lived experience reach out to others and find hope and healing and lift all of us up, individuals, families, and communities.
It's unique in that it provides services for families, that's adults and children, and it makes a heck of a difference in both their lives.
M.I.K.I.D offers groundbreaking programs such as youth peer support, parent support, and transition-aged youth services.
These programs are some of the innovative programs M.I.K.I.D is developing in order to move into the new world of holistic health. But youth support is key. Having young people working with young people, we've seen tremendous strides happen for the young people. The family support program that we've newly implemented is called Parent Support Now, which engages early on families who've had their children taken away by Child Protective Services. We've reduced that out-of-home stay average from 24 months to less than 6 months. We have developed a young adult program. As they've transitioned to 18-year-olds, we've seen some tremendous accomplishments in terms of getting jobs, going to school, etc.
As we navigate through the very confusing process of transitioning an autistic teen to adulthood. And without that access to resources that I had no knowledge of, we wouldn't have been able to do it.
To find out more about M.I.K.I.D, go to mikid.org.